My name is Joe Aherne, CEO of the Leading Edge Group of Companies, a lean education and training organisation. Lean thinking has been instrumental in driving the Japanese motor giant Toyota to the top of the global automotive industry. Thanks to the pioneering success of Toyota, lean concepts have been implemented in countless organisations across the globe, from manufacturing to healthcare, to supply chain, to finance, and indeed to general services. However, there is still a lack of general awareness about what is termed lean thinking. We have asked a number of people from different sectors to give their opinions on what they define as lean thinking and what they see are the benefits of using lean within their own environments. Let's listen to their thoughts and experiences.
Lean thinking is basically going after with a passion the elimination of waste in a company or industry. While I think in fairness most companies would agree that's important to do, very few companies actually get that right, because to actually embed that sort of culture and thinking in a company, you need a lot of things aligned to get that right. So things like strategy, common shared vision, people engagement, training, education, tools and techniques, not just within the company but up and down the supply chain. And not only do you have to do all that, but you have to do it with a shared common goal and with the eye of the customer in mind, what they perceive as value.
I define lean thinking as making a business as slim and as streamlined as possible without impacting the customer delivery or the customer experience.
Lean thinking is the natural evolution of all that has gone before us in terms of looking at work and trying to make it the most productive, efficient, beneficial to any company. Lean thinking starts with the customer and tries to understand what is it that the customer actually needs. Not what we think it needs, but what the customer needs. It then looks at all of the processes from the very start, from the suppliers of whatever it is your raw materials are, all through your internal processes, right through to the final delivery to the customer.
Lean thinking isn't just about manufacturing. It's about all of the processes that happen within the business. If we take the example again of the motor car, people have an idea of motor car manufacturer as this huge factory with lots and lots of robots and cars moving sedately down the line, sparks flying, people building the cars. That process is actually only 15% of the total human effort involved, from the design phase through engineering, the manufacturing itself, up to the point where it gets to the end user who's actually going to be using that car for his everyday life.
Lean thinking for me is about my patients and my staff and the value that is added to their experience in the workplace, in the hospital that I manage. So it's about removing waiting times, removing overworking, removing anything in the process that makes their working life and their patient experience worse.
Waste is a fundamental element in Lean, identifying waste and eliminating waste. Everyone today in our national domain are aware of how much waste goes on, so I think that really puts people aligned to work together to eliminate waste.
Lean thinking for me in healthcare is looking at the resources we already have now and learning to do better with what we have. It's about getting value for money for our patients, for my staff, for processes to flow much better than they do now, and taking the waste out of all those processes that have us going round in circles and getting nowhere fast.
Lean through the sort of elimination of waste and doing everything with customer value in mind. Again, in my view, I have my own little summary of Lean. It's everything, every decision you do and every decision you make in a company you should do with the customer sort of sitting on your shoulder. So with regard to value stream mapping, seeking out every single aspect of everything we do in a company and looking to basically take out waste. Waste can be excess inventory, overproduction, transport, basically doing anything the customer is not willing to pay for.
The benefits of Lean, from my experience as a long-time IT practitioner, would be deciding what projects to go with from an IT perspective for a business. Then in terms of actually doing those projects, to apply Lean principles throughout the project to actually deliver the optimum benefits.
From my current experience, Lean has really made a big difference in the world of outpatients. Now you can, as a patient, know where your referral is in the whole process, because we track and we manage everything in a standard way. So it doesn't matter who you're referred to, you are in that process and you're going through the same pathways as every other patient who's also been referred. Not only that, your referral is tracked. So if you want to find out where you are in the process, we can tell you immediately.
Lean thinking, properly applied to food manufacturing, can lead to significant, for example, cost reduction. Cost reduction in the cost of goods sold, indirect overhead and direct overhead. In our experience and in some pilot cases recently, we have seen 20 to 30% as being achievable in some of the scale industries, businesses in the industry.
Lean gives us the methodology to strive to continually improve our business. We look at our manufacturing process and we are constantly striving to bring that to its optimal condition. We also use Lean to go backwards, and we look at our suppliers and we look at their various setups in order to try and help them supply us with better product at a more reasonable cost. And then we go the other way and we look at our supply chain to our customer, and we try and get that to the best way we can.
My experience of Lean first came about when I worked for Columbia Healthcare in Florida. Lean would have been something that they did as a matter of everyday work. So, for example, a patient pathway, a patient with chest pain was treated the same way regardless of who was treating this patient. It was about getting value for money, it was about minimising risk, it was about quality of care. And it came about because everybody was on the same page working leanly. It was a private corporation, we had to be competitive.
From an implementation point of view, it's actually a very easy approach because it involves everybody in the organisation working with continuous improvement. In our contact centres, we have found Lean thinking to be invaluable in identifying areas where we're wasting resources in terms of outbound, we're handling inbound calls rather than outbound contact strategy. We also found in our claims processing for credit and for customer accounts, when we did our value analysis, we identified lots of areas of opportunity where there was waste.
I hope this video was of interest. You will now have a much better understanding of what Lean is and why Lean is applicable across all business sectors, business processes and across all functions. However, one point to note is that in order for Lean to be sustainable, you must train and educate your people in the principles and methodologies of Lean. Please contact the Leading Edge Group if you would like to embark on a Lean education programme with full international accreditation. Thank you for listening.